Hi, and welcome to our lunchtime Instagram Live Nurses Question and Answer session on this International Nurses Day, very appropriate. Um, my name's Addie. I'm one of the nurse specialists from Breast Cancer Now. I'm joined by my lovely colleague Sonia.
Hi,
Uh,
everyone.
and we'll be answering as many questions as we can in half an hour. So that's all the time we have. So hopefully you will get your questions in nice and quickly, and we'll try and endeavour to answer as many as we can. But I'd just like to say at the beginning a little bit about the charity that we work for. So Sonia and myself are very proud to be nurse specialists at Breast Cancer Now, which is a charity that's powered by world-class research and provides vital support for anyone affected by breast cancer. We have quite a few. We have a lot of resources. We also provide some really, I think, important services for people affected by breast cancer. So we have our telephone helpline, which is a free confidential service. We have so anyone can ring that number. We're open 9 till 4 Monday to Friday, Saturdays from 9 till 1, and you can leave a voicemail. One of our nurses will reply as soon as the office opens. We also have a lovely, lovely group of volunteers in our Someone Like Me service, and who absolutely know how people are feeling when they are diagnosed with breast cancer. So they have all different sort of treatments,
Mm.
backgrounds, ages, don't they, Sonia? And they can fully empathise, and actually, when they're matched up with people, we find that the feedback from that service is really, really great. If you
Yeah.
want more information about that service, do look on our website or phone the helpline,
Mm.
and we can put you through or give you more information or email it to you. So, talking of email service, we have our Ask Our Nurse email service where people can, if they're not confident to pick up the phone, or they just want to explain something in a letter, an
Yeah.
email, a letter. Listen to me, old person. They can email us at nurse at breastcancernow.org.
Yeah.
And Sonia, do you want to say a bit about the other services that we
Yeah.
provide?
Yeah, thank you, Eddie. And I think those are great services that we have here at Breast Cancer Now, and a couple of other services that come to mind. So we have services specifically tailored for younger women. And so if you're 40 and younger and perhaps want to, speak to other women and men of a similar age group, who are going through a similar experience to you, that's always a great service. So it's a younger women together online. Or in person. So we have face-to-face events as well. And as Addie, as you've mentioned, I think if you're interested in joining, either write into us or give us a call on our helpline, and we can sort of talk it through with you in a bit more detail and help to register you for that. We also have the Moving Forward service, which is incredible for people who have completed treatment for breast cancer, and suppose it's more in the follow up remit as to how to cope with life following a breast cancer diagnosis, and it talks you through sort of the what having a breast cancer diagnosis entails, the side effects of treatment, the fears and anxiety, I suppose, of recurrence, and things to look out for. So a really great service, and again, it's in person and it's face to face, and so if that's something that would interest you, if you've completed your treatment or are coming up to completing it, then give us a call on our helpline, or if you don't have the time, as Addie mentioned, write into us. So you can either email, pop us a message on Instagram, write into us on Facebook, and we can help sign you up, and signpost you to the team, and get you on board with that. And then again, I think it's always helpful speaking to us, one of us on the helpline, because we can talk through your individual situation and perhaps talk through the number of services that we have, don't we, Eddie, and find something
Yeah.
that perhaps work
Absolutely.
for you. And it's not one size fits all, is it? And it all depends on what your preference is, whether you like group
Yeah.
settings or whether it's a one-to-one sort of setting that you prefer. So we've got the time to do that. So give us a
Yeah,
call or write in.
absolutely.
Yeah,
It's also important to say that we speak to anyone affected with breast health conditions as well as
absolutely.
breast
Yeah,
cancer, don't we? So,
exactly.
and that could be anyone who has found a lump or has a family thinks they have a family
Exactly.
history of
Yeah,
breast cancer and don't know
yeah,
quite what to do. So it's important to say that we'll speak to anyone, and
yeah,
never feel it's it's in an inappropriate call, because it's really
exactly.
not. They're just as important as the people that have been treated and phone us that are diagnosed with
Completely
breast
agree.
cancer.
And we get it quite a lot, don't we, Addie, on our helpline, that people think that they're wasting our time, or they're wasting their GP's time
Yeah,
with a
yeah,
query concern, but you're not at all. And it's
no,
always worth giving a call so that we can talk through your situation, speak to your GP as well. You get the reassurance, if it is the reassurance that you're looking for from your GP, and take it from there.
absolutely.
Yeah.
Well, I think we have a couple of questions
Yeah.
already, so I'll kick off now.
Yeah.
And so, and this is this lady's username. Carol
Mm.
Milestone says, "Is collagen okay to take?" I presume that Carol's probably had a breast cancer diagnosis,
Sure.
Sonia. But yeah,
Yeah.
what
Yeah,
do we
thank you for
say?
that question, Carol. And so I think, again, it's something that's quite often routinely asked. People call in or write into us asking about vitamin and herb supplements, because quite often we find that, especially when you completed your treatment for breast cancer, you want to do as much as you can to be healthy, or sometimes it could just be to help manage any side effects that you're experiencing because of breast cancer treatment. And I suppose there is often that belief that with vitamins and herbs, they're safe to take because they're considered natural. And I think if we're specifically talking about collagen, Carol, it's not yet possible for us to say if it is safe to take collagen supplements.
Okay.
We know that there is research looking into collagen levels and breast cancer, but it's not yet clear if this would mean to completely avoid collagen supplements or to take them. What I would suggest is it's always a good idea to speak to your breast care nurse if you have one, your breast care team, your
Yeah.
GP, your pharmacist are a great resource. Talk to them about why you want to take collagen. Perhaps if it's managing side effects that you're experiencing, or you simply just want to be healthy, which is okay. Talk to them about it, because they can talk through your individual situation with you. They can, if you are currently on any treatment for breast cancer, they can also tell you if it will interact with any
Yeah.
treatment for breast cancer. And so it's always worthwhile doing that. I think if you wanted a bit more information as well, I would signpost you to the Memorial Sloan and Kettering website. You can simply
Very
type
good.
in collagen, and they will talk you through any interactions and the risks of collagen. There is also the World Cancer Research Fund, isn't there, Addie? They have a
Yes.
helpline.
Very
Uh,
good. Yeah.
yeah, and
Yeah.
so you could always call through to the helpline, and speak to an oncology trained dietitian. Talk again about collagen in a bit more detail, and hopefully they might give you a bit more information. Or equally, give us a call. And I think what you'll find on our website with breast cancer on our website is we have fantastic information about being healthy after having had breast cancer and
Yeah.
after breast cancer treatment. There's also videos on there on our YouTube channel, so you can have a look at that. But you're welcome to give us a call, and we can maybe talk through it in a bit more detail. But I think, right now, what I can say is we just don't know whether it is safe to take or not.
No, absolutely. I think that's a really good answer. And actually, there has been a sort of I guess, a question along those lines as well in the
Mm,
chat. So from Princess
okay.
5910,
Yeah.
hello, is it okay to take a multivitamin if I'm
Yeah.
tamoxifen? And she's 46 and 5 years of taking 5 years of tamoxifen. And again,
Yeah.
I think you've probably answered that question quite well. That we don't know. We would encourage her to go and speak to her team.
Absolutely.
They usually, if it's a multivitamin, it would usually be inclined to say yes, but
Mm,
we're not aware of her individual situation. So
exactly.
yeah, it's always best to ask, isn't it? So,
Absolutely.
um,
Yeah. All right, Addie. So I'll ask
good.
you a question that's come through.
Uh-huh.
So this is SKSSS_10 has said, I would like to know if I have a little lump in my breast, is that possible breast cancer?
Okay, so this is a really good question,
Mm.
of which we get many similar to this. Obviously, like I said, people calling our helpline or writing in with breast health problems and conditions and symptoms, and a lump um, is a very common symptom, yes, of breast cancer. But it's really important to say that most changes, including lumps, are not breast cancer. So it's really important to say that, and that lumps can be. There's lots of benign, non-cancerous things they can be, such as
Absolutely.
cysts or fibrous
Yeah.
lumps like fibroadenomas. And but what's important to do is, if you find a lump that's new or different, it's really important to report that to your GP, because 9 times out of 10, you possibly, depending on your age, might not even have to go to a breast clinic to be
Mm.
assessed.
Mm.
But you may be asked to come back if you're still having periods, for instance, to see if it actually disappears, because sometimes it does. What's also important is getting to know what your normal is. So particularly, well, it's for everybody, including men, because men can get breast cancer as well, less than women. But it's really important to check regularly so that you know what's normal for you, maybe a couple of times a month. In the beginning, especially if you have a menstrual cycle, but sometimes the breasts are very changeable anyway, even if you don't have a menstrual cycle. So it's really important to get to know what feels and looks normal for you, so that if there's anything new or different, that you can
Yeah.
report it. And
Yeah.
it's really, the other thing to say is that it's really important to do touch, look, and check, which we have a vast amount of information on, don't we, Sonia, about how to
Absolutely.
check yourself
Yeah.
and where to check. So it's
Yeah.
important to examine all of the breast
Yeah.
tissue around the nipple area and the nipple
Yeah.
itself, into the armpit and up to the collarbone, and look in a mirror. So look,
Yeah.
touch, look, to see if there's any changes, and
Yeah.
check. So, and go check anything new or different out with your
Yeah.
doctor, as I said. So, I think it's a really good question. If you have got a lump that's not going away, or it's new or different for you, some people, for instance, are very vulnerable. They're very prone to getting cysts and things.
Mm. Mm.
Even if you have that, don't just assume, if it's another
Yeah.
lump, oh, it might be another cyst. You
Yeah.
should always get it checked out, and there's nothing to lose
Absolutely.
by doing that. And
Yeah.
actually, you know, uh,
You're not wasting anybody's time by doing that as well. So
no.
it's, yeah.
And of course, the earlier, if it is a breast cancer,
Mm.
the earlier you're checked out at a breast clinic and new and diagnosed and treated, the better the outcome's likely to be. So we know that actually
Mm.
the earlier that breast cancer is treated, and most of them are treated successfully, um, the better, isn't it,
Absolutely.
Sonia?
And
Yeah.
it's good to hear that this person is obviously breast aware, and it's, as you said, Addie, just familiarizing yourself with what your breasts feel like. There's no
Yeah.
right or wrong way to check. It's just regular checking, because by doing that, you will be able to spot any new changes, which, as you've said, go to your GP, and your GP can clinically examine you. And as you said, most of the time it could just be that you don't need a referral to a breast clinic.
Hmm.
But even if you do need a referral to a breast clinic, I think it's good to know that they have the resources to be able to investigate what's going on. So
Yeah.
it doesn't automatically mean that there's something worrying going on. But yeah, yeah, just any new changes, get them checked out.
Yeah. No,
Yeah.
absolutely. That we've had a few more questions.
Yeah.
Oh, so Hazel asked, could you mention the name of the website for nutritional support again? It sounds
Yeah.
very useful, as there's so much
Mhm.
conflicting information, which is very true. I really
Absolutely.
empathise with you, Hazel,
Yeah.
about that. Yeah.
Yeah, so there
So,
was a couple that we mentioned, Hazel. There's the World Cancer Research Fund. So we can, if we're not able to share the link, if you Google, they should come up. And as mentioned, they have a helpline as well, that you can speak to a oncology trained dietitian. But then there's also the Memorial Sloan and Kettering, which is a great resource for any herbs or supplements that you were considering to take. But goes without saying, I think always go back to your treatment team, Hazel, pharmacist,
absolutely.
and or your GP, if you were considering taking something. Um, So again, I think this is similar to what you've just responded to, Addy. We've had a question from Arvish underscore Chandani asks, is a 20-year-old woman likely to get breast cancer? You have sort of touched
She's
upon this.
22. Yes,
Yeah.
absolutely. So, breast cancer is, we don't know what actually causes breast cancer
Mm,
in most people, do we,
no.
Sonia? But most breast cancers are in women over the age of 50. And as you get older, there's
Mm,
a, as you get very old, there's a 1 in 7 chance of developing breast cancer. So the older you
yeah.
are, the much more
Your
likely you
risk
are.
increases. Yeah.
That's right. And being a woman is,
Yeah,
we
absolutely.
know, it affects mainly women, but like we said, it can affect men as well. Um, there's only a small percentage of women, of people that with a family history that develop breast cancer. But again, it's, if you have got a strong family history, it's best to go and get it checked out with with a family history clinic or your GP initially. But so in answer to your question, most breast cancers would not occur in 20, 30, 40-year-olds. But we know, of course, because we have our younger women together groups, and we know that there are a percentage of 20 and 30-year-olds, 20 to 30-year-olds that will get breast cancer. And it's, we don't know what that is exactly. We think
Mm,
sometimes it might be their hormonal levels, but there's no way of actually proving that. And again, because you're well under the age of screening, I
mm,
can't just emphasize how important it is to be breast aware. And like we said, most of those changes that you find, or lumps and bumps and thickening, which is, and it's very difficult to check yourself when you are so young, when you've got very nodular lumpy breasts, but it's really important to check regularly, to see what's normal for you, Arvish, and hopefully that reassures you a little bit. Yeah.
yeah,
So
definitely.
um, thank you for that. We've got a question from somebody who's completed radiotherapy.
Mm,
Um, so Shine. TT Shine says, hi, I finished radiotherapy almost 18 months ago and have been left with what looks like red spots or lines on my
yeah.
lower boob. Can I do anything to improve these? I use moisturizer every day. Thank you.
Yeah. Oh, thank you for that
So,
question. I
mm,
mean, so it's not uncommon. We know that with radiotherapy, you know, it is associated with skin changes, and how long this lasts does vary for every individual, doesn't it, Addy? I
yeah,
mean, it can take
absolutely.
a number of months to a couple of years to completely
Yeah,
resolve itself. And in some cases, you may find that, it's the skin will never perhaps completely look as it did prior to radiotherapy treatment. It's good to hear that you're using moisturizer.
yeah,
There wouldn't be any specific moisturizer that we would suggest because there isn't enough, again, evidence or research to say that one particular brand of moisturizer works better than another.
yeah,
It is essentially what suits you and what's good for your skin. Again, worthwhile speaking to your treatment team about it so that they can review it perhaps. We have
yeah.
a great Facebook Live session on scars, don't we, Addie?
Yes,
Which
that's right.
might be worthwhile for you to have a look at because it
Yeah,
does cover skin changes as well, and perhaps management options as well. But I would say it sounds like you're doing the right thing by
yeah,
moisturizing. Give it time. I know it's been 18 months, but you may find that it does gradually improve with more time. But again, if it's concerning you, I would say speak to your team because
yeah,
likewise, any persistent changes or side effects that you're experiencing is always worthwhile just to have that
yeah.
conversation with them.
Definitely. No, it's
Yeah.
because I think it sounds like it could be that the condition called telangiectasia, which is
Mm,
kind of quite difficult if that's what it is.
mm,
It's very difficult to treat, and I don't think, moisturizers perhaps won't make much difference. So, but
okay.
just, yeah, like you say, it's really important, isn't it, to check it out. So,
Yeah,
yeah, yeah, no, that's
absolutely.
good.
Thanks,
So,
Addie.
no.
Oh, this is let's have a look. So there's another question in from Miss underscore I suggest. So she has said, is there anything that I can take to help with the menopause as we can't have HRT?
Yeah, no, this is something that comes up a lot, isn't it,
Yeah.
Sonia? Because it's really hard, like, and it depends on what sort of side effects you're experiencing, but it's really difficult for women who,
Yeah.
have got presume you've got estrogen receptor positive breast cancer
Mm.
or not, but I mean, and you've got menopausal symptoms.
Yeah.
The problem is, there are things that are on the market, for that haven't got estrogens in them, but a lot of the supplements and things that we were talking about earlier
Yeah.
contain, estrogens, don't they? And so again, you have to be really careful and
Yeah.
definitely speak to your treatment team about whether you
Absolutely.
can take certain things.
Yeah.
And again, it depends on the sort of side effects
Mm.
that you're experiencing. So, there are things that can be done for, say, things like vaginal dryness, which we know
Mm.
is a real problem with,
Absolutely.
with having the menopause when you've got breast
Yeah.
cancer, or after breast cancer. And there are things that you can do. So there are lubricants and moisturizers that you can take. Lubricants are sort of short term, but will help with discomfort and soreness. And moisturizers are more sort of fit to use daily.
Mm.
And again, speak to your treatment team about
Yeah.
what's safe, because again, some of the moisturizers do contain estrogen in them. I mean, there is some oncologists, if you're really suffering with that, will talk about having vaginal estrogen, because they believe that it's not going to have much effect on on your breast cancer returning. But it needs to be talked about with a specialist. You know, we can't actually recommend that.
Mm. Mm.
Um, and in terms of other side effects, such as hot flushes, again, there are things that you can
Mm.
take.
Absolutely.
And also, if it's because you're on hormone therapies, which is really common, you can talk about, if you've given it a try and you're really not getting very, very far, talk about either having a different brand if you can. That's sometimes quite difficult, but you could talk to your team about maybe changing your hormone therapy. I mean, I really don't know what your treatment was,
Mm.
unfortunately. So, it's difficult to say in general, isn't it, Sonia? But it's about, because you might be absolutely fine on one of the hormone therapies and somebody else might be
Mm.
really suffering. So it just depends on why you've got menopausal
Yeah.
symptoms, or
Yeah.
as to
I
what
think it's
what to do.
always it's as you said, Addie, it's always a good idea to communicate that with your team, because it may not be that you necessarily need to take another type of medication to manage your side effects. It could be you could speak to them about complementary therapies, for instance.
Hmm.
But as you said, talking
Very
about the
useful.
actual tablet, changing the brand, maybe. Thankfully, there is a number of management options available, aren't there? Have a look at
Yeah.
our menopause and cancer leaflet, our publication that can be accessed on our website as well, because it has a lot of information about managing whichever side effect that
Really
you are
good.
experiencing. Yeah.
Yeah,
Um,
absolutely.
but give us a call, because I think it's as you said, Addy, it's difficult to perhaps necessarily give you specific suggestions if we don't
Yeah.
know
Yeah.
what's going on. But
Yeah.
many people struggle, unfortunately, don't they, with menopausal type
Yeah.
symptoms, side
But there
effects
are
of.
things, like you said, there are things we can
Yeah,
help you, navigate as well, if you
absolutely.
give us a call or drop us an email. So yeah, please do
Exactly.
that. Yeah.
Yeah,
Oh,
exactly that.
okay.
I think we've come to time now, haven't we, Eddie?
I
We've
think we have. Goodness, it's
yeah,
gone quickly.
it
And
has.
yeah, I mean, I think and actually, I think we've answered most of the questions that we've
Yeah,
we've had in,
yeah,
which is great. Like we said, please do,
yeah.
give us a call or email us.
Yeah,
Look at our website. Yeah, we have a wealth of
exactly.
resources and information, and
Yeah.
yeah, I mean,
And I
hope
think
that's given you.
a special shout out for secondary services, because we didn't mention that, but
We didn't, but
we have a lot of secondary services
they're amazing.
available.
Yeah,
Yeah,
we do.
so call us, and we
Yeah.
can talk to you about that as well.
And just a quick one to say that the Younger Women Together, the Younger Women is for women under age 45. I think you said 40, but
Sorry. Yeah.
no, it's okay. It's like,
45.
it's an Instagram thing, isn't it? Yeah, no, it's a 45 and under. So, we can help,
Yeah.
with that. So,
Yeah, and
but
then the younger women with secondaries as well. So again, if you wanted to meet with other women of a similar age,
yeah,
so yeah, give us a call, and we can talk it through. Email us if you don't feel comfortable having a conversation about it or just don't have the time.
thank you. And thank you everyone for joining
Yeah.
us. And thanks, Sonia, for your
Thanks, Addie.
great support.
Thank you,
And have a
likewise.
good day, everyone. And yeah, hope to speak soon.
Yeah.